When you have entered the land the Lord your God is giving you as an inheritance, and have taken possession of it and settled in it, take some of the first fruits of all that you produce from the soil of the land the Lord your God is giving you, and put them in a basket. Then go to the place the Lord your God will choose as a dwelling for his name.
In 2001, two physicians went on a missions trip to Honduras, where the team treated over 1,800 people in need. When they returned to the Tri-Cites, they reflected on how this experience might benefit our community, and thus a seed was planted. Friends and physicians, Carol Endo and Cheryl Snyder, decided that they had a shared vision for a clinic which would treat the whole person, medical, physical, spiritual, emotional needs, all treated without cost. After connecting with others in the community, they agreed to pray for 40 days.
By January of 2002, a unanimous decision was made to call it Grace Clinic. The acronym for GRACE being God's riches at Christ's expense, and all agreed that it would be a free clinic run on Christian values and principles for those with no insurance or limited ability to pay. And then they had two requests of God if this was really his desire. They needed a facility and a facilitator. Dr. Cheryl Snyder graciously committed to become the first medical director, and I believe it was within 2 days she stood in the basement of the First United Methodist Church in Pasco, looking at what would become the first location, the first home for Grace Clinic.
6 months, the small team of volunteers met weekly to develop the mission and policies for the clinic. Significant time was spent in prayer. It took yard sales and individual donations to fund the vision, as well as discarded but usable medical supplies to stock the clinic. Volunteer contractor Bob Johnson and his subcontractors made it possible to turn the basement space into small exam rooms and a reception room. The clinic would open for 4 hours a week on Saturdays. The doors opened June 1st, 2002, with 50 committed volunteers, but there was no patients. It was a great time of prayer. By September, the clinic had treated 100 patients, attracted more volunteers, and received funding from United Way.
By 2003, hours increased to full days on Saturdays and 1 half day, 1 Friday per month. The first patient coordinator was hired, and generous donations of medications through group health and samples from drug representatives filled a gap. Over 60 medical referral specialists stepped up to offer their services, and because of this, a young woman with a brain tumor was diagnosed and successfully treated.
Susan Campbell accepted the position of clinic administrator at the end of the year, and by 2004, her passion, organizational skills, and energy were contagious. Grants were written, additional staff was hired, and many political leaders wanted to visit Grace Clinic. But despite improved efficiency, additional volunteers, and more staff, sometimes as many as 40 patients per weekend were turned away. Even volunteer physicians were being turned away because there were not enough exam rooms for them to use. We began regular prayer meetings, and a decision was made to designate a percentage of the donations we received to a building fund called In God's Time and Way for His Glory.
In 2005, Grace Clinic began offering spiritual care, leading many patients and their families to commit their lives to the Lord and start their journey of faith. The volunteers represented over 30 churches, and financial support came from over 15 churches. During this time, specialized management for diabetics began working with over 60 patients, and mental health services expanded. By June, Grace Clinic had seen over 4,000 patients in just 3 years of operation, and the best was yet to come. The site for the new Grace Clinic location had been chosen. Budgets were in place, the lease was signed, and the future of Grace Clinic was about to take a huge leap of faith.
The amazing transformation of the old Kennewick Sea Galley restaurant into the new Grace Clinic began in February of 2006. Bob Johnson and a crew of subcontractors kept the expenses significantly lower than anticipated, and community support swelled. On September 8th, Grace Clinic officially opened with great fanfare, serving 47 patients, twice the number that we were ever able to serve at the old location. In October, the clinic was able to add 4 hours every Tuesday for patient visits. With the additional space in the new location, a food cupboard was established for emergency needs.
Jean Murrow was hired in early 2007 as the director of Grace Clinic. She brings great expertise and enthusiasm. The dental clinic also opened that year, offering much needed dental help for patients. 2008 brought welcome support from the United Way in the form of 3 grants for diabetes, for mental health and community partnership, and for health promotion and treatment. In that year, the Emmaus Center became Grace Clinic's community partner for mental health services.
During 2009, we continued to experience growth at Grace Clinic and recently marked the 20,000th patient visit since the clinic opened. We see about 400 patients per month, and of those patients, a significant number say that if Grace Clinic did not exist, they would have nowhere to go for their health care. They simply wouldn't be seen for their medical illness. We have seen over this past year a 20% increase in patient volume, although we've turned away roughly 900 patients, due largely to space, time, and financial constraints. Next year, there will be approximately, it's estimated, 40,000 residents of Benton-Franklin counties who will have no health insurance. The problem is not going away.
Honor the Lord with your wealth, with the first fruits of all your crops. Then your barns will be filled to overflowing, and your vats will brim over with new wine.